I like to talk about diabetes, and I kind of hook it up with two other medical diagnoses, and I call them the tres amigos. So we have diabetes, hypertension, and high cholesterol. And because they like one another so much, they usually hang out together. So if you happen to have hypertension, I'm also going to screen you for diabetes and high cholesterol. And so with the other two, if you have high cholesterol and or diabetes, I'm going to be looking for your other two friends. And I think this is really important because if you have uncontrolled diabetes, uncontrolled hypertension, and uncontrolled cholesterol, that puts you at increased risk for strokes and heart attacks. And so when you're going to your healthcare provider, whether it's a PA, mid-level, or physician, we're trying to really reduce your overall risk for heart attacks and strokes because, again, those have long-term consequences. The signs and symptoms of diabetes. Again, signs are actually what your body is doing, and symptoms are kind of what you're feeling. The most common signs and symptoms and how they're described is called the 3 Ps. It's called polyphagia, polyuria, and polydipsia. Now, those are big medical terms, but in easy layman's terms, it's you're very thirsty, you're very hungry, and you're going to the restroom a lot because you have to pee. So those are the basic signs and symptoms of type 2 diabetes and even type 1. So if you notice that that's going on, I would encourage you to go see your healthcare provider and maybe get screened for diabetes. It's usually a simple blood test, or again, if you're feeling very dizzy sometimes or cranky, I guess we call it hangry now when you're hungry and you're also angry. And sometimes that can also be a sign of diabetes, or maybe your sugar is also getting too low when you get really cranky and angry. And so again, we always encourage you, if you feel like that you're just kind of not doing what you normally do and you're not feeling well, those are really signs and symptoms that you need to go see your physician. And also, people kind of forget that high sugar can be very, very dangerous, but low sugar which is called hypoglycemia, is more dangerous because it actually can lead to seizures in the case of hypoglycemia or low blood sugar, because in the case of your brain, sugar is the first energy source that your brain uses. Let's talk for a moment about the complications of type 2 diabetes. And diabetes, if we want to name her as a female, she's not a very nice lady sometimes. She has her moments, and again, her moments can get unchecked. And when diabetes is uncontrolled, it can lead to very kind of disastrous health complications. And I think previously we used to think of diabetic individuals losing feet, maybe having an amputation below the knee, losing a kidney. And right now, those are all very disastrous complications. But right now, again, when we're looking at diabetes and uncontrolled diabetes, you have an increased risk for heart attacks and strokes. And that's kind of like why we're really encouraging people to get management for all chronic health conditions, diabetes, hypertension including, and also depression. Because if you're depressed, it's hard for you to take care of yourself because, again, you're not feeling great and therefore the motivation is down. So we'd like to really address not only your physical needs, but also your psychosocial needs to just get an overall better feeling for your health and to reach your potential in your health.